And we're back on the Healthcare Business Network. You can find us at hbnradioshow.com. That's www.hbnradioshow.com, where business and healthcare is our business. So we're back here again with our guest, Holly Louie. We're talking about the transition to ICD-10, which is a major transition. Whether you work in a private physician practice or you're working in a hospital, doesn't make a difference. This is going to have tremendous impact on how you do business after starting in 2013 and thereafter. So where I wanted to go with this, Holly, was what do you need to be doing right now? You're a practice manager, or you're whether you're in a hospital or whether you're in a private practice. What are the things that you need to be thinking about right now?
Well, I think the first one is, if you've not already done so, you need to familiarize yourself with the coding requirements and what they're going to look like. Fortunately for all of us, you can access that information free on the CMS website. There is a tab on the CMS website for ICD-10 resources. If you are a member of the Healthcare Billing and Management Association, we have an entire section of our website dedicated to ICD-10 links and resources. And there is also vast information available on AHIMA.
And I would assume also other organizations, though I don't want to put words into anybody's mouth, but for example, like AMA and let's say AMA and HFMA, I would think they would also be focusing on this issue as well, too.
Absolutely. The coding organizations are. The American Hospital Association clearly is. So there are vast resources out there at this time to help you prepare.
So let me ask you, how would you start to effectively train your staff? I guess you got to really put together a game plan and get buy-in from your people that you're working with.
Well, you do, and I think it's time to make decisions of whether that would be a time to consider coding-assisted software, automated coding products, or other resources. The best information we have right now on production, on coders, was from Canada, and they experienced about a 6-month loss of production in coding. And keep in mind, that is for a one-payer system. It was a small subset of the ICD-10 codes, and it was for hospital inpatients only. So I think we need to be prepared that we need to start implementing some things and some training now to avoid that huge hit in production and effective operations at implementation time.
So you could be holding yourself up from a half a year of potential revenue,
yes,
essentially when this is implemented.
Potentially.
What is the U.S. government's response to this, or have they had any response, or they've just pretty much ignored it?
Well, I think they recognize it, and I think they are making concerted efforts to educate the provider community and the coding community and the business community of the potential downsides of ICD-10 implementation. And with the prospect of you have time now, get busy and prepare so you don't experience these negative events.
Question about certified professional coders, which are employed by hospitals, private practices. Are they going to have to be reaccredited for ICD-10, or what's going to happen to them?
That is my understanding from all of the major coding organizations, is that there will be additional education provided and additional testing to certify that you are capable in ICD-10 coding, yes.
Will there be do you know if there'll be an exam, a formal exam, as CPCs do sit for now to get their current accreditation?
That is my understanding, is there will be an additional exam. Now, I don't know if that's cast in stone at this point in time or if it may change depending on the organization. But I think that is the plan, is to certify that coders have expertise in this particular new code sets.
So if you're sitting in a hospital right now or private practice, you've really got to put together, just looking at one segment of this whole change, you just need to beyond many different types of plans you need to put in. You need to put in a financial plan, a software plan, but you need to put in an education plan to get all your people educated on this in terms, I guess you got to choose what types of courses you want them to take, what you're going to budget for them. Is that correct?
Absolutely.
So you really have, I mean, the type of business planning that you have to engage in right now is fairly comprehensive and is going to touch all areas of your organization.
Yes, it is. And as part of that, obviously, you look at what kind of reporting do you rely upon or give to your clients that uses ICD-10 codes, and where you go to in the industry for information. Many of the national coverage determinations will have to be redone. 100% of the local coverage determinations and payer policies will have to be redone. Pre-authorizations, all those types of things that are driven off of diagnosis codes today will also be driven off of diagnosis codes then, and all of those are going to change.
Now, talking about different types of plans, segmenting it into different areas for your office, let's look at vendors here, software vendors, for example. Who are the vendors, in addition to software vendors, because they're the most obvious, who are the vendors that you need to be watching and that you need to start engaging right now?
Well, I think you need to analyze your hardware as well as your software to make sure it can accommodate these changes. If you currently use any type of automated coding products or coding assisting products, you need to be talking to those vendors to see what their plans are. Can they support you for ICD-9 and ICD-10, or can they not? I think probably those are the most important ones because those are the ones that really affect how you perform the duties of coding in your organization.
And a big issue, which I know concerns you a lot, especially when just reading your background at the beginning of the show, because you've been a person, an individual who's been so concerned with compliance, billing compliance, other areas of compliance in the physician's office, is what do you foresee as the impact of the transition to ICD-10 on your compliance program? What is it going to do?
I think it is going to require, at least initially, much more intensive auditing and monitoring for coding accuracy as people learn the new systems and learn the new rules and understand the new policies to make sure that they are correctly reporting the codes that are represented by the physician documentation or the procedures that were performed.
I'm sorry to interrupt you.
No.
Do you foresee rewriting your compliance program possibly?
I foresee not necessarily rewriting the compliance plan, but I foresee much more intensive, as I said, auditing and monitoring. I foresee much more careful interfaces with our clients for a period of time to make sure the physicians understand the new requirements and what needs to be in the medical records. I think if you use an automated electronic health record or a type of an automated record that codes, that is going to require intensive analysis to make sure that there are no compliance issues during this transition.
When you look around right now, and again, this is not really, I'm not asking for a scientific answer here because it's really, I guess, more based upon what you see out there, but what is the response been from both the hospital and provider communities out there? Have they been putting in the time to get ready for this in your estimation, or has it been more a wait and see type of approach? What have you seen up to now?
Well, it's some of the general meetings representing the healthcare billing industry at large and medical community at large that I've participated in. Although there are certainly efforts to prepare, many organizations and physician practices are handicapped tremendously by a number of things right now. As you well know, there are many other federal healthcare initiatives rolling out at the same time. We have high tech, we have, PPAC that's under fire every day. We have other initiatives that have drained dollars and time and resources when people are having to cut budgets and cut back. So it has been extremely challenging throughout the industry to really allocate the resources necessary to get to where we need to be at this point and to meet the deadlines.